Have you ever sat down to breastfeed, cradling your baby close, only to feel that sharp, burning pain that makes you wince before your baby even latches? You tell yourself it's normal, maybe just part of the process, because everyone says breastfeeding shouldn't hurt forever. But deep down, you know something isn't right. That moment, that hesitation before you feed your baby, is where so many mothers find themselves torn between wanting to nourish their little one and fearing the next wave of pain. Let's be honest, breastfeeding pain can feel isolating. You might see other moms smiling as they nurse, seemingly at ease, and wonder why your experience is so different. Maybe you've already heard phrases like, "It's just your nipples adjusting," or "It gets better with time." But what if the pain doesn't go away? What if, instead of easing up, it lingers, intensifies, or starts to feel wrong? The truth is, while mild soreness can be normal in the early days, serious breastfeeding pain is not something to ignore. It's your body's way of saying, something needs attention, and recognizing that message early, really listening to your body, can make all the difference in your breastfeeding journey. There is a moment many moms remember vividly, the day they realize this pain isn't just normal. Maybe it's when you notice your nipple looks cracked or blistered after a feed. Maybe it's the shooting pain that runs deep into your breast even when your baby isn't nursing. Or maybe it's the swelling, redness, or that sudden, feverish ache that makes your breast feel heavy and tender to the touch. These signs can all point to something deeper, from a poor latch to blocked ducts, or even an infection like mastitis. But here's the good news. None of these issues mean your breastfeeding journey has to end. What they do mean is that you need care for both your baby and yourself, because as much as breastfeeding is about nourishing your child, it's also about protecting your own well-being. Think of this video as a calm, supportive chat with a friend who's been there, who knows what it feels like to cry through a feed and still want to keep going. We're going to talk about how to recognize when pain is a sign of something serious, and what steps you can take to find real, lasting relief. First, let's start with what normal really means. In the early days after birth, some tenderness can be expected. Your nipples are adapting to a whole new kind of contact. The latch may take a bit of practice, and your body is still adjusting hormonally. That mild soreness, usually fading within a week or two, often feels like sensitivity rather than sharp pain. But once the pain crosses into the territory of stinging, throbbing, burning, or aching that lasts beyond those early days, that is not something to push through. The difference might sound small, but your body always knows. Persistent pain means it's time to take a closer look. One of the most common culprits is a poor latch. You've probably heard that phrase a dozen times, but let's unpack it in a real-world way. When your baby latches well, their mouth covers more than just the nipple. They take in part of the areola, their chin presses into your breast, and their lips are flanged outward like a fish. You'll feel a deep pulling sensation, not a pinch. When the latch is off, though, even slightly, your nipple can be squeezed or rubbed the wrong way. That friction builds up fast, leading to cracks, bleeding, and sharp pain that makes you dread the next feed. Sometimes, even if you're doing everything right, pain can still creep in. Maybe your baby has a tongue tie or lip tie conditions that restrict movement and make latching deeply difficult. Or perhaps your breasts are engorged, making it hard for your baby to get a full mouthful. It can even happen if your milk flow is too fast or too slow, causing your baby to adjust awkwardly while feeding. You might also experience pain that radiates deeper into the breasts, especially after feeds. That deep ache could suggest a blocked duct, when milk isn't draining properly from one part of the breast. You may feel a lump, tenderness, or even warmth in that area. Left untreated, a blocked duct can lead to mastitis, an infection that brings fever, chills, and often intense pain. Mastitis can sound scary, but when caught early, it's highly treatable. Rest, frequent feeding, and, in some cases, antibiotics can help you recover without weaning. For some mothers, the pain feels sharp and burning, even between feeds. This could be a sign of thrush, a yeast infection that affects both your nipples and your baby's mouth. Thrush pain often feels like pins and needles or stabbing sensations that linger after nursing. If your baby also has white patches inside their cheeks or on their tongue, it's worth asking your healthcare provider about it. It's important to remember, none of these conditions are your fault. They don't mean you're doing something wrong. They mean your body is asking for help, and you're wise enough to listen. Too often, Mothers suffer in silence because they believe pain is just part of the package, but you deserve to feed your baby comfortably, confidently, and without fear of the next latch. Now, let's talk about how you can start finding relief, safely and gently. If the pain feels unbearable, it's always okay to pause and take a breath. You can express milk by hand or with a pump to keep your supply steady while you rest your nipples. Applying a warm compress before feeds and a cool one afterward can help reduce swelling and soothe inflammation. Checking your baby's latch with the help of a lactation consultant can be life-changing. Even one small adjustment, like changing your baby's position or supporting your breast differently, can completely transform the experience. Many hospitals and community clinics offer free or affordable lactation support, and it's one of the best investments you can make for both your comfort and your baby's feeding success. You can also look for signs of healing: your nipples feeling less sensitive, your baby latching more smoothly, your breasts draining evenly. These small victories matter. They show that you're not just surviving breastfeeding, you're relearning and growing with your baby. For some mothers, recovery takes time. There might be days when you feel like you've either taken one step forward and 2 steps back, but please remember, every feed, every cuddle, every quiet moment with your baby is progress. You are doing something incredibly beautiful and brave, even when it's hard. Sometimes, the hardest part about breastfeeding pain isn't the physical discomfort itself, it's the emotional weight that comes with it. You might find yourself questioning whether you're strong enough to keep going. You might even feel guilty for not enjoying breastfeeding the way you imagined you would. But let me say this clearly. There is no shame in what you're feeling. Pain changes everything: your mood, your confidence, even your bond with your baby. Acknowledging that doesn't make you weak. It makes you honest. And that honesty is the first step toward healing. When you're in pain, every small decision: when to feed, how to hold your baby, even whether to get out of bed, can feel monumental. The good news is, you don't have to face these moments alone. There are professionals who specialize in exactly this kind of situation: lactation consultants, midwives, and breastfeeding counselors. They can help you identify what's causing the pain, whether it's a latch issue, an infection, or something deeper that needs attention. Sometimes, the fix can be surprisingly simple. A change in position, for instance, can completely shift how your baby latches and reduce friction instantly. Try leaning back slightly while feeding, a position known as laid-back breastfeeding. It uses gravity to help your baby latch naturally. Or, you might find side-lying feeding more comfortable if your nipples are sore. Each mother-baby pair is unique, and what works for one might not for another. It's all about experimenting gently until you find what feels right for both of you. But in other cases, when the pain continues despite trying everything, it's okay to reach out for medical help. Persistent, sharp, or deep pain, especially if it's accompanied by fever, swelling, or redness, may mean an infection or blocked duct needs treatment. Mastitis, for instance, can escalate quickly if ignored. Early intervention with rest, frequent feeding, hydration, and sometimes antibiotics can help you recover quickly and prevent complications. If your pain feels more like a deep, burning sensation, especially if it happens after feeds, it might be a yeast infection thrush. In that case, both you and your baby will need treatment, since yeast can pass back and forth during nursing. It's completely treatable, but you'll want to talk to your healthcare provider right away, so you both can heal together and avoid reinfection. You might also hear the term vasospasm. It happens when blood vessels in the nipple tighten after feeding, often triggered by cold or trauma. The result is a sharp, stabbing pain that can last for minutes after your baby It can feel confusing because it's not constant. It comes and goes, but it's very real. Warming the area right after feeds, wearing soft, breathable bras, and treating any underlying latch issues can make a big difference. No matter the cause, the goal is always the same: to restore comfort and confidence in your feeding journey. Because when you're not in pain, everything changes. You start to look forward to those quiet feeding sessions again, the way your baby, as tiny fingers curl around yours, the sound of their soft swallowing, the feeling that you're doing something so deeply natural and nurturing. Let's pause for a moment to talk about your mindset. When you're struggling with breastfeeding pain, it's easy to spiral into spouts out. You might even wonder if your body is failing you, but your body is not the enemy. It's working tirelessly, healing, adapting, producing nourishment, and learning something new every single day. That tenderness, that ache, that discomfort, It's not a sign of failure. It's a sign that you're pushing through something that takes real strength. If the pain ever feels too overwhelming, it's okay to take a step back. Pumping for a few days, using nipple shields temporarily, or even supplementing while you heal doesn't make you any less of a mother. It makes you resourceful. You're protecting your ability to feed comfortably in the long run. Think of it as hitting pause, not stop. And here's something that might comfort you. Most breastfeeding pain, even the serious kind, can be resolved. With the right help and a little patience, your body will heal. You'll reach a point where feeding becomes easy again, where your baby latches, your milk flows, and you both relax into that moment together without flinching or fear. It might help to keep a gentle routine of breast care as you recover. After feeds, let a few drops of breast milk dry naturally on your nipples. It's as full of healing properties. Use breathable nursing pads to keep the area dry, and avoid harsh soaps or creams that can irritate sensitive skin. If your nipples are cracked, a medical-grade lanolin or a natural nipple balm can offer soothing protection. And don't underestimate the power of rest and hydration. Your body needs both to heal and maintain your milk supply. If you're dealing with blocked ducts, gentle massage before and during feeds can help loosen them. Try feeding your baby with their chin pointing toward the tender spot. It helps drain that area more effectively. And if you notice your symptoms improving even slightly, celebrate that progress. Healing often happens in small, steady steps. Perhaps one of the most important reminders of all is this: breastfeeding should be a connection, not a constant challenge. Yes, it can be demanding. And yes, it can hurt sometimes, but it should not leave you dreading the next feed. If it does, that's your cue to reach out, ask for help, and advocate for yourself. You don't have to tough it out. You deserve comfort. You deserve peace in this journey. And if you're watching this right now while holding your baby, maybe with tears in your eyes and that familiar ache in your chest, please know, this moment will not last forever. Pain is temporary, but the bond you're building with your baby is lasting. You're doing an incredible job, even if it doesn't feel that way right now. Before we close, let me leave you with this gentle encouragement. Healing doesn't mean perfection. It means progress, feeding without fear, finding comfort in your own rhythm, and trusting that every small adjustment, every act of care, is moving you closer to ease. And in the next video, I'll share something every mom facing these challenges will want to know: how to soothe nipple pain and care for your breasts while breastfeeding. We'll talk about simple, natural ways to heal faster and prevent pain from returning. See you there.